This lecture is going to talk about intervention laws. In order to even assess children and enroll children in services, there are certain laws that are in place to ensure that children who have language disorders, disabilities, etc., get the services that they need, particularly in the school setting, in the early intervention setting, etc. Because children are entitled to free and appropriate education in this country. So, part of the intervention process is to be aware of. First, let's talk about IDEA law PL 10517. This is often referred to as Part C of IDEA. And basically, this covers that birth to 3 years of age population, and it is about addressing the needs of the family. It considers the resources as well as their priorities and their concerns. You can follow this link to get more information about IDEA Part C, but basically it is approximately a $436 million program that is administered by the states that serve infants and toddlers through 3 years of age who have developmental delays or who have been diagnosed with some type of physical or mental condition, with a high probability that that physical or mental condition will result in developmental delays. With regards to Part C, um, anybody who is concerned about the child, a doctor, a parent, or child care provider, can refer the child for you know an early intervention program in the state. Here in Georgia, that is called Babies Can't Wait. Okay. And so anybody that's concerned about the child, who has contact with the child, can make that referral. But oftentimes, the provider will alert the parent that they're concerned about the child's development, or either the doctor, the child care provider, and the parent can be given resources for how to contact that early intervention program. Okay. Um, with this program, the parent gives consent or is asked to give consent for an evaluation in cognitive and hearing, and physical abilities, communication abilities, social emotional development, and adaptive abilities. Um, and in general, all of these things are done within 45 days. The evaluation of the five major developmental areas in the IFSP meeting, which is short for Individual Family Service Plan meeting, is scheduled if the child is eligible based upon their test results. Now, keep in mind, the IFSP is different from the IEP, which is the Individual Educational Plan. The IEP goes with school settings. These are for school age children. The IFSP is for children who are birth through three. Okay. The IFSP is written by a team, which includes the parents, and it is about looking at the child's current levels of functioning, the family's resources, priorities, and concerns. The outcomes that are listed on the IFSP are specific to the child and the family, and they do provide a criteria for measuring progress. With regards to early intervention services, it'll talk about in that IFSP plan what specifically they're going to get, what type of services they're going to get, how frequently they're going to get it, how intensely they're going to get it, the method of delivery, and the environments. Is this going to be in the daycare? Is it going to be at home? Those are the typical settings for IFSPs. It's either the home or either the daycare. It's in their natural environment. Okay. So we want to make sure that the setting should be in a natural environment. If not, a justification must be given for on the IFSP. So for example, the child's you know needs a setting outside of the home. So if it's going to be a group setting or at a clinic or other settings, or they need um, to be seen in a medical facility or something like that because the child's medically fragile, etc., those type of things. Okay. The IFSP is supposed to be reviewed and revised as needed every 6 months. And part of the person that one of the people that coordinates this is called the service coordinator, and they work with all of the different service providers, PTOT speech, to help coordinate that all of these things happen. And again, it can be reviewed and revised every 6 months, but it doesn't have to be revised every 6 months. But it must be reviewed annually. Okay, so if after 6 months no changes are proposed at the IFSP meeting, which can just include the family and the service coordinator. Let's say the family says, yes, things are going well, we don't need to make any changes, then it keeps moving forward, into, the rest of that year. Okay. So they do have to meet with the family, every 6 months, but it doesn't necessarily mean that it's going to have to be revised. Okay. Um, Annually, progress is reviewed in terms of measurable outcomes. So the changes need to be made to reflect the current level of developmental functioning or prior or family priorities. As the child gets to the age where they will age out of this service, which is around 3, transition plans have to be put into place, and this has to happen 90 days prior to the third birthday. So the child could go to preschool for additional services or get services through the school. Okay. So that's what the SEA and the LEA stands for, because LEA is the local education. Um, Excuse me. The LEA is the local educational authority, whereas the SEA is like the state educational authority. And at that point, the child exits at age 3 the Part C, which is exits Part C of IDEA, which is early intervention. And if you want to know some more information about early intervention, you can look and follow this link, and it'll show you some information about IFSP meetings, etc., and also some of the laws that go along with early intervention. I'll also post this link on CourseDen. Now let's talk about laws for school-age children. Prior to the passage of many of the federal laws that we have in place today, many children with disabilities were unserved or underserved by the public schools. So recommendations had been made prior to this time for serving children with disabilities, but it became clear that federal legislation would be required in order for students with disabilities to receive free and appropriate education. Many people contend that special education began with the passage of the Education for All Handicapped Act. Um, so we have what we call, starting with the Rehabilitation Act, which was kind of like the first attempt to get services in place for children who have disabilities. But the issue was that there was no funding to support it and back it. So it wasn't really happening at the level that it should. So that's why a lot of people argue that really, good special education or good system started with that Education for All Handicapped Act. Because what happened is it provided at that point federal funding to support the mandate in the act. This act did later get replaced and in the Education for All Handicapped Act was enacted in 1975. And this did later get replaced by what we have now, which is the Individuals with Disabilities Education Act, which is IDEA. That's what I've been mentioning and talking about, in the previous slide. So IDEA stands for Individuals with Disabilities Education Act, which came about in 1990. Okay, but basically, it applies to all children, and they still use the term handicapped children, or we may say children with disabilities, between the ages of 3 and 21 years of age. And there's funding that backs it. However, if the states do not comply with the law, okay, which is to provide free and appropriate education to children with disabilities, okay, and not to discriminate against these children, then they will lose the funding that backs it. So a lot of states do not want to lose that funding. That's why there is always such a pressure to make sure that they comply with that particular act. Although provisions have been made or had been added or amended in order to expand the provision of services to younger groups of children with disabilities, or to improve the quality of services provided under the law, the four purposes of IDEA have remained essentially the same. Okay? And so here is the law, here is the act right here. Schools must provide a student with a disability free and appropriate education. Okay, that's FAP, designed to provide meaningful educational benefit through an individualized education program. That's where your IEP comes from. Okay, within that law, the goal is to ensure that all children have available to them that free, appropriate public education that emphasizes special education and related services designed to meet that child's particular needs. And so they can also help them to access the curriculum, and to ensure that the rights of children with disabilities and their parents or guardians are protected. It's also meant to assist states and local education agencies or authorities with providing education for all children with disability, and to assess and ensure the effectiveness of efforts to educate children with disabilities. It is because of this law that we, as speech pathologists, are employed and have a job in the school systems, because we're helping to do just that. Some other guiding principles that have also come into place, and you've heard this, is the least restrictive environment, LRE. So all children with handicaps or disabilities should receive instruction in the least restrictive environment possible, to the extent that their disability permits. And then also, Title II of the Americans with Disability Act requires schools to provide, without charge, auxiliary aids and services to ensure that students with disabilities can communicate as effectively as other students, with primary consideration for student and parents' preferences. Let's talk about the IEP. The IEP is updated at least once a year by the team, kind of similar to the IFSP. Okay. A full reevaluation must be performed every 3 years. So the IEP must be updated once a year, but an actual retesting of all of the different areas by the psychologist, speech pathologist, and everybody else is something that has to be done every 3 years. So within that reevaluation, you're going to be describing the excuse me current level of performance, the desired level of performance, providing objectives and goals for the year, transition plans and services to other settings, particularly if the child is starting to get older and will be aging out of school. If you're talking about high schoolers that are 19, 20 years, because children with disabilities have a longer time to be able to remain in the school setting. Up until and to receive these type of settings up until age of 21. But if as they're getting ready to age out and transition out, transition plans have to be put into place. And then the methods for which progress is going to be measured. Is that going to be standardized assessments? Is that going to be portfolios from the classroom? Reports and interviews from the parents and from the teachers, etc. Here are the IEP categories that are used in the schools. So children would fall in one of these categories for receiving services: autism, ED, which is emotional disturbances, learning disabilities, hearing impairments of deafness. We now use instead of mental retardation, we now use the term intellectual disability. Multiple disabilities, meaning the child has multiple things going on, specific learning disabilities, speech or language impairments. So, as you can see, we do fall under that, even by itself, we fall under the umbrella of an IEP or special education. Traumatic brain injury, visual impairments, and then other health impairments. Um, in Chapter 9, we also, you know, consider whether a child falls in a single category or several categories. A child can have both a language disorder and a learning disability. In many cases, that's often the cases. So, in some cases, the language disorder leads to the learning disability. So, language based learning disability is considered a single disorder that manifests in different ways at various points in development. When we're talking about these type of children, these children are going to have issues providing labels based upon features. Um, they'll have difficulty processing. Um, they also have difficulty processing grapheme for phoneme associations, poor decoding skills. They'll have underdeveloped and non-specific lexicons, so they'll use a lot of general words instead of using more specific vocabulary words. That you may see issues with word retrieval and categorization. They may have a slow rate of learning syntax and not really good morphological skills, which can lead to reading deficits. And they may have poor conversational and repair skills and difficulty with organizing their conversation. They may also have passive conversational skills as well. So they let you lead the conversation instead of them leading or initiating a conversation. And these kids also may have difficulty forming cohesive narratives with a big picture focus. Um, so, when you ask a child to do some of the school-based tasks, which we often ask them to do, which may be, label an animal based upon these features. A lot of times teachers may play these type of games with the kids and say, what animal has four legs and black and white stripes? Okay, most kids can easily come out with zebra, but our kids would have a difficult time coming out with those words, and they would also have difficulty doing things like defining words. What is a hammer? Well, kids with typical development and good vocabulary would be able to say, well, it's a tool that you use to build things and nail things together or things like that. But a child with, this type of disability would have difficulty with those type of tasks. There's also specific language impairment. I've talked about this in assessment, where a language disorder exists in the presence of any other known etiologies, and some of these kids may be are late are kids who were late talkers when they were younger. If you were to test these kids, you don't see any cognitive impairments, you don't see hearing loss or physical disability, brain damage or syndrome such as ASD or any other developmental delays. So even though they may be the only kids on our caseload, we still have to go through the IEP process, the consent process, and we're still entitled to consider that IDEA Act when working with these kids. You can follow this link, and I'll put it on CourseDen in order to actually look at a example of a child with SLI or example of SLI characteristics. Some of the characteristics of SLI, also include difficulty with negotiating, explaining, expressing, particularly with non language impaired peers. They have a hard time collaborating with those kids. Poor reading and academic performance, which will definitely impact their school and academics. Issues with vocabulary developments. Their vocabulary is smaller and less diverse than other children. Issues with word retrieval and immature social behaviors. Many schools are, in addition to, of course, following the IEP process, referral process, and etc., and the laws, many schools have begun to um, in, or to use the response to intervention model, and then that's basically where children have to move up to different levels in order to be put into special education or to receive intensive intervention services. So, kind of what's different from what has happened in the past. Really, the true thing that's different is this secondary level. A lot of times, kids used to go from that general primary instructional level right into early intervention and intensive intervention. And so schools have said, we've had too many kids on in the special ed caseload that may have been helped by some other steps in between. So that's that secondary level where you may do things like small group activities and adjust some classroom modifications. You may do more progress monitoring. It could be that the child didn't have as much exposure to different vocabulary when they first came into school, so they just need some little steps and modifications along the way to catch up. And then if the child doesn't respond to those type of adjustments and modifications and a little extra help here and there, or well, a little bit of extra help or more help, then that's when you take them up to that next level, which is to special education.